No employer is perfect and no agency is perfect. I had to learn that the hard way since I came to the United States. This is your boy Muhammad, and I'll be talking about 2 upsetting events that I had to go through. Oh, I forgot to change my clothes. I've gotta change this. That's more like it. Okay, before we start, let's kick in the intro. Oh, there's no intro? I thought there is. Okay, let's go ahead. The first event is an unfair position for the healthcare professional to be put in by the agency. The other event is a deficit in the education program that failed to meet expectations. In this video, I'll be talking about both events that I've encountered and the solutions I found for them. I'll start with the medical insurance or health coverage. Avant has a very good health plan when it comes to single people. Yes, you get a good coverage for a cheap price compared to the market. But when it comes to family coverage, oh my god, it's so expensive in comparison to what's out there from insurance companies and health plans. So let me give you some numbers. These are not real numbers, by the way. For example, the healthcare provided by Avant for a family of 4 would cost you $1,000 per month. Where on the other end, you'll be able to shop around for the same health plan, even with better deductibles, at a lower price. Let us say $300 per month. But that is not my beef with Avant Healthcare insurance plans. Actually, my concern with Avant medical insurance plan are 2 things. 1, your insurance plan will only be effective after 60 days from the day you enroll. And during those 60 days, you're a sitting duck, praying for God you don't get sick. Because if you do get sick, you're fucked. You all know what happened with me. Usually, I'm pretty healthy. I have never taken anything apart from Tylenol for the past decade. But I had the worst eye infection ever when I came to the States. Initially, it started with my left eye. I had a pink eye, then a red eye, then both eyes were infected. Update on the eye. It still sucks. Actually, it's bilateral now. It hindered my abilities to focus at work. It made me irritable and anxious. One day I felt so sick and fatigued, I wanted to call in sick. Hey guys. Today is Friday, June 16. I'm not feeling so well. Yesterday I went to the convenient care to check out my eye. She gave me an eye drops, antibiotics. I tried them, but now it's more red and it's even tender. So it hurts. I just wanted to sleep in today, so I'm dragging myself to work because this is not fun. At first, I tried clear water from Walmart for a couple of days, but that didn't work. Then, on a Thursday, I went to convenient care. I had my eye checked by a doctor. I'm here at convenient care, and actually this convenient care is also... this convenient care is also a branch of Carl. And I just came here because my eye is hurting. You can see. I've got a red eye. I don't know if it's infected or not. Here in the States, like, you cannot get over the counter eye drops with antibiotics, so you have to see a physician. So I don't know how much that would cost me. She ordered eye drops with antibiotics. They said that whenever my insurance kicks in and it's activated, maybe I can get a reimbursement. So fingers crossed, hope they reimburse me. Now I'm gonna head to the pharmacy to get my eye drops with antibiotics. And I'll try it for a couple of days. I hope it works, because this is very itchy and red and I have watery eyes. So fingers crossed. Do you want to guess how much it cost me for the eye drops? Anyway, it's $26, $25.99. I hope the insurance will reimburse. So if not, that's the first. This is not covered by insurance. This is covered by my butt. I started using the eye drops right away, but actually it got worse. On Friday, it was all swollen, it was tender, it was watery. It was awful. So I had two choices. Either go back on Friday to convenient care and have that doctor check it out again and accumulate another bill, or wait till Monday, fight through the weekend, keep using the antibiotics, and hopefully it will work. Saturday, it even got worse. The swelling, the tenderness, the redness, the crusts when I wake up. So by Saturday, I had two options. Wait till Monday and go to convenient care again, or seek emergency care. And if you don't know, if you go to the emergency department, you're gonna pay $300. On top of the tests they're gonna run, the specialty consultation, and the medication they're gonna order, and so forth. I know health is important, but I don't wanna accumulate bills, so I hung in there, waited till Monday, went to convenient care. So back at convenient care, check on my eye. Actually, it's getting worse. So I've been having problems with this eye for 2 weeks now. I wasn't feeling good because of my eye all night. I was irritable and so anxious. Actually, it is bilateral now, so I went to convenient care. I took like 2.5 hours of work. Another physician checked it out. He checked it out. He ordered another 2 eye drops. He gave me broad spectrum antibiotics and anti-inflammatory. So I accumulated another $110 for the doctor's bill, and the medication cost $62 and $22, a total of $84. My insurance will only kick in on July 1st, so in 10 days, but this has to be treated right away, so never mind the money, health is more important. So after my second visit, they referred me to an ophthalmologist. They called me, they tried to schedule me for an appointment, but since I don't have insurance, they refused to see me, even if I had to pay out of pocket. Still, there is 11 days for the insurance to kick in, and my eye is not getting any better. I am concerned now because the other eye is infected as well, and my fear is that it would affect my vision. I struggled for 11 days, and everyone at work was feeling sorry for my situation. I was looking like a drug addict with 2 red, watery eyes. July 1st, insurance kicked in. I booked an appointment with an ophthalmologist. I went to the appointment. He checked my eyes, did all kind of tests, used all kind of instruments. So he changed my eye drops to Tobradex, which is tobramycin and dexamethasone. And he put me on oral doxycycline antibiotics for 14 days. After the first day, steroids did its magic and I was fine. So my second concern is that Avant tried to hide information from us regarding healthcare coverage. Every single one of us is eligible for Medicaid. I had to figure that on my own. My wife is eligible for Medicaid because she's unemployed and she's pregnant. Both my kids are eligible for Medicaid because they're under 18 years old. I'm the only income in the household, and you know how much I get paid. I would have been eligible for a full coverage health plan from Medicaid for those 60 days. Both my kids had to go for physical and dental checkups for their schools. Both of them had to receive a couple of immunizations, and actually both of them got PPDs. My youngest has big tonsils and they are investigating to decide on tonsillectomy. And just tonight, we put him on pulse oximetry overnight to check for desaturation during his sleep. Want to check it out? And you want to know how much it would have cost me if there's no Medicaid? Look, see the number? $437 for one procedure. What about doctor's visits, medications, labs, vaccines? And actually in his labs, he had iron deficiency, so we put him on iron for 3 months. Oh my god, if they were not on Medicaid, can you imagine the bills I would have accumulated? So Medicaid is one of the solutions, but you want to hear another solution? Every hospital in the United States has a patient assistance program. So one of my colleagues overheard me talking about the hospital bills. So she directed me to a patient care representative and she encouraged me to apply for the patient assistance program. I have applied. I gave them all the supporting documents, the bills I've gotta pay each month, the rent, the utility bills, you name it. They gave me a preliminary approval. They will pay whatever Avant's insurance will bill me. Co-pays and deductibles, not only for myself, but for the whole family, for 1 year. My second setback was with their driving program and their driving education. I admit they have one of the most solid driving programs I have ever seen. They have brought experts to teach the program, one of the most respectful driving schools in Florida. But they missed on one little single detail that cost me $172 so far. The tolls. Basically, if you want to travel from one city to another and you want to take a faster route like the highway, then you've got to pay a fee. That fee is called toll fee, iPass, iExpress, whatever you want to name it, you can name it, but you have to pay the fee. Usually the toll fee is $1, $1.50, maybe $2. So I had 2 trips from Urbana to Chicago. The first trip was to pick up my family when they arrived to the United States from Chicago Airport. And the second trip was to Chicago Airport to pick up the shipment from back home. One violation ticket came through so far, and it's $172. Apparently I passed 8 tolls. The toll fee is $1.5 and the fee for passing it without paying is $20. So you do the math. $172. Every single step of the way I've been involving Avant with what's going on with me. They've been supportive, but they haven't been supportive. They have been supportive by answering my emails, but they couldn't do anything about it. Still, I had to pay the bills. So my insurance said anything before July 1st, they will not cover it and they will not reimburse it. And in regards to my medical bills, my toll violation bills, and all the struggles and troubles I went through during the whole 20 days my eyes were infected, there was no compensation. This video is meant to help others, give you awareness and orientation to the healthcare system in the United States, where you can find assistance, guidance, and coverage. My goal is to prevent you and your family from being a sitting duck. Because family is important, and healthcare is not a game.
What the fuck is that? That's not a game!
Hey guys, I just want to say something by the end of this video. If you're still watching, I love you. Please like, share, and tell your friends about me. Your support is really appreciated. Every like, every share, every minute you watch, it's appreciated from the deep bottom of my heart. Thank you very much.